IBM notes language use as an early sign of Alzheimer's disease. A new study found that an AI program analyzing language predicted up to 74% of participants diagnosed with Alzheimer's later in life. Conducted by IBM and funded by Pfizer, the research was published in the journal eClinical Medicine. It is the latest study in the emerging research area dedicated to the early detection of Alzheimer's disease. Alzheimer's disease is an irreversible, progressive brain disorder. It gradually deteriorates a person's memory, thinking skills, and their ability to accomplish the simplest tasks. In older adults, Alzheimer's is the most common cause of dementia. In the US, it is one of the leading causes of death. IBM's research analyzed over 700 written samples from 270 participants in the Framingham Heart Study, or FHS. FHS has gathered detailed medical histories, lab tests, and physical exams from thousands of participants. The individuals were presented with a cookie-type picture and instructed to write a description of the photo. The samples were gathered when the participants exhibited no signs of memory loss. The research predicted Alzheimer's disease an average of 7.6 years prior to diagnosis. IBM's research based the written samples from 80 participants. It found that the study accurately predicted Alzheimer's than other methods like demographic or psychological tests. Risk factors include repeating questions, stories, and statements, and agraphia, or loss of one's ability to write. A.J. Royeru, IBM's Vice President of Healthcare and Life Sciences Research, noted that IBM's initiative to track language could be a potential non-invasive test. For Royeru, it presents a better window to targeted interventions. Tracking language patterns throughout a person's lifetime could also be included in a routine physical or behavioral health exams. Doctors might collect and monitor a baseline of an individual's language skills as a young adult. Royeru said the test will be updated every 5 years. There is no cure for Alzheimer's, but treatment can help manage symptoms in certain individuals. Presently, scientists undertake studies to find ways to better delay the onset of Alzheimer's, prevent it from developing, and treat it. Dr. Oscar Lopez, a professor of neurology and psychiatry and the University of Pittsburgh's Alzheimer's Disease Research Center's director, shared his thoughts. Developing reliable data from prospective studies that follow patients over dates can be a challenge when using a language test, said Dr. Lopez.